Nothing. No, I'm not doing anything.
Hi, Mom. Oh, okay. One of the things to make sure after you position the patient,
okay?
and I did not position this patient, okay, so just be clear. But you want to make sure that the knees are back, right? The knees are back. Actually, we're going to do videos eventually for this. I just finished doing for the travel, and apparently I go really quick at it, so that's good. But you want to make sure the knees are off the edge of the, or back of the table, which means you can, it's okay to bend. There are others that will say you shouldn't do that. They're just wrong. It's okay. I'm going to post this on YouTube, better not. Okay, so if I'm doing a modified, then his knees are out of my way, and I can get back here and get a really good I to S line of drive. I want my legs against the table, so if I got to move my will, right? I'm going to get where I need to be, right? The whole palpating for the contact point. For a modified, you're going to come in here, take your thumb, and put it right in between the mastoid and the jaw. It's just that fossa. I don't have a big fat thumb in there, just the tip of my thumb. It's just a point, a visual cue. Take my chiropractic index finger, find the tip of C2. The notes will tell you to go 3/4 of the distance. Now I'm on the posterior arch right there. I keep my finger there. I got to take my pisiform and come down and then scoop in at the end. That sets me in position. Set the headpiece. Come in, get my elbow bend set. I'm set for a lateral setup right now. Right? Posterior, I lean over this way. See, and I feel the pressure against my leg. If I'm going to go anterior, you do not lean this way because you lose the I to S. What I do is, he's got these little petite shoulders, so I'm going to just roll his shoulder back a little bit and come in this way. And I just move my leg back maybe 6 inches, and now I'm coming in I to S with that A to P line of drive. Okay? What would determine how much rotation to include? How am I going to make that decision? Looking at the film. We've got a lot of rotation, I'm going to have to put more of the vector. So that's why it's not just posterior, anterior. That's for a test, obviously that's all you're being asked to do, but in reality, you've got to look at the films. If I got somebody who's got a lot of posteriority, I may have to come way over the top to get that angle and set that down. Okay? So that's modified. Does that help?
Very much so.
Okay.
With the torque on, is it?
Yeah. No, oh, good question. Modified, we torque for what? Says it on the board.
Speed.
Torque for speed, right? So we're always going to torque down the spine. Okay, so in this way, if I'm on the left side, I'm torquing clockwise. If I'm on the right side, I'm torquing counterclockwise. Good. CCW. Right? For traditional, now what I'm telling you guys to do is start here. Don't start back here. This is what I keep seeing. Everybody looks at their line of sight and they look straight down, and now you're not going S to I. So for this one, what you're going to do is you're going to come in, find the TVP. Okay, find the TVP. It's in there somewhere. Move the earlobe out of the way. That's why I use the chiropractic index finger. There's my contact point. The pisiform, bony pisiform, is here. It's not here. If you are sliding down with that big fleshy part, you are wrong and you will lose points. Yes, it is. Okay, it's right there. It's that bony pisiform at the crease of the wrist. You can see it just by looking along this line. When you make this, it's right there. Okay, so that's what I'm looking at. I'm watching you set up, and I just have to watch the crease of your wrist. It's right there. And you just follow it right around. I'm giving away the tricks. Oh no. Okay, so find that little tiny mastoid. Okay, I'm going to scoop in like this, make my contact, and be nice to him. Okay, take my contact, set the headpiece, get my contact there, come up. Right? So now I've got straight lateral. If I've got an inferior listing, I'm going to have to torque clockwise. Superior listing, I'm going to have to torque counterclockwise, right? Anterior, I just move back this way. Posterior, I toe in, lean over the patient. The thing I'm watching you guys do is you're getting down so low that you're having a hard time to get over. You have to get yourself up. Over the top this way. Okay? Cool? Rock and roll.
Cool beans.
Cool beans. Sweet.
Awesome.